showing that you are listening, asking about a child's interests, asking about a family and client priorities, partnering, letting parents, we can do this together, and making an empathy statement. These are just a couple of the skills that we discussed today on the show. I had an amazing conversation with Dr. Jessica Rohrer about the importance of compassion. We've been talking about compassion a lot here at ABA Speech. We have a really nice self-paced course in our CEU library, the ABA Speech Connection from Leanne Page, all about soft skills, parenting, and compassion. It's a great one. Today with Dr. Rohrer, we talked about compassion as a provider. I'm going to include the show notes for two of the articles that we discussed today. A really nice takeaway if you want to work on this skill set either individually or with your own teams. Dr. Rohrer is a doctoral level board certified behavior analyst and licensed behavior analyst in the state of Connecticut. And she's the director of consultation at CCSN, where she provides leadership and program development support to the consultative team. She received her master's degree in ABA through Northeastern University and her doctorate in ABA through Endicott College. She's worked as an adjunct professor, and she is presented nationally and internationally on topics such as staff training, preference assessments, increasing independence. And her work has been published in many journals. Thank you so much to Dr. Rohrer for coming on and talking about this very timely and very important topic. If you like these topics, talking about compassion, assent, ABA, speech therapy, all the things, let me know by leaving a review on Apple Podcasts and let me know, do you love these topics? Are you enjoying the show? That allows other people to know that we are over here talking about important things. Let's get right on in to this conversation.
You're listening to Autism Outreach Podcast, a podcast full of ready-to-use strategies to help those with autism strengthen their communication skills. Here's your host, Rose Griffin of ABA Speech, a speech therapist and board-certified behavior analyst who shares tips you can use in your next therapy session.
Welcome to the Autism Outreach Podcast. We have a great show for you today. I'm very excited about our guest. Thank you so much, Dr. Jessica Rohrer, for coming on to the show today.
Thank you. Thanks for having me and inviting me to be here.
Absolutely. And I was telling her before we pressed record that sometimes when I have a moment, I'm just digging into the research, usually probably every week, just to see if there is research out there that would be nice for me to talk about either here on the show or to do a CEU about, because I don't have to tell you that research to practice gap is one that is really tough. And so that's something that we try to do here at ABA Speech, is try to bring the research that is current into the hands of the people who are treating and just try to be up to date with best practices. So I came across one of your articles. I'm excited to talk about it today because I think it's such an important topic. And we've been talking about it, compassion. We did a really nice ACE and ASHA course about compassion with Leanne Page, which was it was called Soft Skills, Parenting, and ABA. But we talked about a different article that had to do with compassion, which I love that because just like yours has a lot of good takeaways, there were like checklists and things that we can think about. Are we being compassionate? And how can we talk about this in our pre-service training, which I think is so important because I've been a speech therapist 20 years. I've been a BCBA 12 of those years. And, we didn't talk about that a ton, doesn't stick out in my mind. And so I think it's great that the field is kind of moving this way to talk about these things. But enough of me. So tell us a little bit about you and just your journey into the field, kind of what you're up to now in your work.
Sure, no problem. And I agree with you, by the way, that I'm glad that, we're seeing this shift in the field toward compassion. So hopefully this will be another step in that direction. So I sort of credit the New England Center for Children as, for sort of showing me the impact that ABA can have on kids, with building skills and being able to kind of navigate their worlds with increased independence. That was my first real sort of job in ABA. Prior to that, I had been like substitute teaching and doing various things with kids in education. But this was a kind of a cool experience to be on the floor and learning about it at the same time as I was implementing it. I pursued my master's degree while I was working there at the New England Center through Northeastern University. And then I completed, the master's degree while I was working there. And then after that, I've done some different things. I told you, I think in the email, I had lived in Ohio for a couple of years
Nice.
and worked at the OSU Medical
Oh,
Center.
that's right.
At the Nysanger Center. So that
Yeah.
was cool. And in that capacity, I had the opportunity to go into homes and work with families directly. That was sort of my my in-home experience.
Mm-hmm.
And then I did some traveling. I lived in Central America. I did some different things. And then since being back, I've been primarily here at in Connecticut at the Center for Children with Special Needs. And in this role, I oversee a division of program consultants, BCBAs, who do consultation work in public schools, building capacity with school teams to support their most complex learners.
Ooh, so you're busy is what you're saying.
Yes,
That's a busy job. So I own this small business, ABA Speech, but I work 2 days a week in my kids' own school district. And yeah, it's a whole beast. It's been interesting. I had Dr. Bruce Tenor on, and we just talked about BCBAs in school districts, because what we're seeing here in Ohio is that the old consultant model, where it's like a clinic who sends a consultant into a public school, that's kind of getting, I don't want to say it's passe, but here in Ohio, in my region, a lot of school districts, big and small, have their own BCBAs on staff. And I know that that is just bringing up a whole lot of other questions when you're a consultant versus you're an employee of the district and our ethical code. And there's so many things. So I definitely have been thinking, like, how can I help school-based BCBAs, because it's just really different. It's really different, I feel like, than it used to be. So, that sounds like really interesting work. How cool. So the article that I came across that we're going to talk a little bit about today is Teaching Compassion Skills to Students of Behavior Analysis, a preliminary investigation, which I thought was very interesting. I teach the ethics course here at Kent State. And I've done that for like maybe 6 years, which has been fun for me. I actually really like ethics. I know that may not sound nerdy to you because you're a PhD, but I really like ethics because it's, structured. And I think that's the way my brain works, but it's so gray, right? I like work. It is. I like working with students. But can you share kind of I know before we pressed record, we were talking about the importance of this, but can you share just like the importance of this compassion piece, and this idea of students, learning these things too, why that is so important in our field?
Yeah, absolutely. And I think, as you said at the beginning, the field is really moving in this direction. And I think specifically with regard to the ethics code that you mentioned, it's nice that we now have these 4 overarching principles to the ethics code that really serve as that framework for the rest of the code items. And one of those code items actually relates directly to compassion, which, is good and interesting, but I think also leads us to needing to kind of understand what that means and what that looks like in the field and how to integrate it into our work. And so I think we're sort of just now starting to get there as a field in terms of operationally defining that and figuring out how to integrate it into students' work and supervisory experiences. And that's not to say that there haven't been people in the field doing very compassionate work and doing, work that is very socially valid. And so I don't mean to undermine that all that work that's been done, but I think it's nice to see it coming up as something that's more present and discussed, readily.
Yeah, I love that. And here at ABA Speech, we do these. I have this membership, the ABA Speech Connection. So every month we do new AASHA and ACEUs. And next month we're doing a journal article that is happiness, indicators of happiness, I think, in treatment. I haven't read the article yet, but I think that's going to be a really good article. I've also had Jennifer Posey come on, and she's talked about joy in therapy. We've had Dr. Cody Morris come on and talk about, assent. And I think those are just really, and I think that's it. Like, the field is kind of growing and adapting, but I think it's neat to be able to talk about these things because it's just, it's just kind of different. Like I had on a BCBA that's been in the field. Actually, this BCBA saw Skinner at conferences before.
Oh, wow.
And this BCBA said, things are very different, like, and even if you go to an ABA conference versus a speech therapy conference, it's so different, right? An ABA conference is like, okay, here was our research, here is our data, here is, and it's so, I think they call them symposiums. It's just like very, very different versus a speech therapy conference where there's still data and we still talk about research, but it's just wildly different, the nature of the actual talk. So I think this is cool to be able to talk about these things. When I was reading through the article, you talk about two tools, which I'm excited for you to kind of talk about a little bit more. One is called the Jefferson Scale of Physician Empathy, Health Professions version. And then the other one is Compassionate Collaboration Tool. And I would love for you to talk about these. I know that when Leanne Page did that CEU for us, there was some study, and I'm sure you know it, and I can't remember it, but it was like these cancer patients were going through some treatment and they just did this before and after. And like, I think all the doctor said was like, how are you feeling? Or it was like some kind of empathetic statement. And it just changed like how the person thought of their overall visit. And it was just, everybody on the talk was like, oh, because it's true. It's like when you're going through something, you want to feel validated. And I think sometimes, especially as a new clinician, I know when I was working with parents before I was a parent and before I was older, I just felt nervous, and you feel like, is this important? Should I just stick to what the script or, what am I doing here? So I think sounds interesting, but can you tell us a little bit about those tools?
Yeah, sure. So the Jefferson Scale of Physician Empathy is, it's the most commonly used measure for assessing practitioner empathy that is reported in the medical literature. So it's not really used in behavior analysis. It's used in the healthcare field. And that's why, I thought it would be interesting to incorporate it sort of into my study. And it was utilized in my study as kind of an ancillary measure. It wasn't the primary dependent variable, right? It was just sort of like, hey, what if we take pre and post scores of this and like see if anything changes following training on compassionate care skills. But the scale of physician empathy include things like they have statements and then you sort of rate them on a Likert scale. So it says things like, I try to understand what's going on in my patients' minds by paying attention to their nonverbal cues and body language. Or my patients feel better when I understand their feelings. And so we substituted, patients for like clients, for things that are relevant to the behavior analytic world. But there's been a number of studies using the Jefferson Scale of Physician Empathy, Hojat and colleagues in 2011 and some other years, if you're interested in reading a bit more about sort of how it's been used. But yeah, we didn't use it in this study very rigorously, but instead as sort of a pre and post measure just to see whether there was any change in the results following training in compassionate care skills, which there was.
Oh, wonderful. That's amazing. And then the compassionate collaboration tool, is that something that you developed?
Yes. And that's published in a different paper.
Okay.
That's something that I developed along with some colleagues of mine at Endicott. And that really came out of sort of something similar to what you were describing. We sort of noticed this deficit in the field or this challenge in the field in terms of the way that, practitioners may have been engaging with stakeholders, right? Families or clients or whoever. And I think to your point, as a newer clinician, I certainly was not told to do any of these things, right? Or we're not told that any of these kind of soft skills or interpersonal skills would be important, or that I should say these things, or that I should try to develop therapeutic relationships with my families. Like it was just sort of like go in and kind of get the job done. And so the compassionate collaboration tool is a checklist, like I mentioned, that was developed sort of because of that need that we noticed. And we really just synthesized a lot of things that had been discussed in other fields, primarily healthcare and psychology, social work, and created hopefully a usable tool that might be a helpful next step for people that are trying to incorporate these approaches into their work.
Yeah, I think that's great because I think sometimes we just assume a lot about RBTs, BCBAs, students. Like I know like in Facebook groups, it'll be like, are there any videos on how to play? Because in RBT, like is this new student and they might just say, okay, you want to pair with this student.
Right.
And it's like a 4-hour session. And the RBT is like, Now, this is obviously, I'm overgeneralizing, but these are things that happen. Or, I remember in the past, like I had a parent say that, and this parent had some concerns, but they were like, "Oh, my personality didn't mesh with their 2-year-old or something like that." And I was highly offended by that. I don't know if she had an agenda, but it's like, I have 3 kids of my own. I see a lot of preschool age students. That's all I talk about now in my business. But, I don't know, like, did I do something to offend her? Did I not act overly interested? Like, my personality now is more bubbly because I make online short form videos about ABA and speech therapy, but not everybody's like that. So, you just go back and you think about some of these situations and you're like, well, could I have done something differently? Did I, you just don't even know because you assume you're like, oh, just go do this intake with this family who, had a child who was just diagnosed with autism or is going through the process. And now they said you need ABA and here they are in your office. And it's just, there's so many things. And when you're dealing really with younger students or even who have an older kid and they're transitioning to adulthood, it's just, there's a lot of emotions involved. And I feel like you're just not equipped, so that's why I think it's nice to kind of firm up some of these things, like these are things we can do. Can you talk us through some of those skills that were trained in the study?
Yes, absolutely. So the study that was published in the paper that you referenced was an online study. It was virtual. It initially was not intended to be, but then it was COVID. So it was a virtual study.
Yes.
Yeah, which actually turned out to be a nice shift that we were able to undertake because it turns out that a lot of the, participants and then also, people who were functioning in a role of, either clinician or in some way in the field, we're interacting with these families virtually for 3 years.
Right. Depending on your state. Yeah. And your regulations.
Yeah. So, it really became very, very relevant. And so, I think to your point, we started out by trying to take a look at things that would be relevant, that would be considered, compassionate and collaborative, but also relevant to a virtual platform. And so the first, there were 3 skill sets that the skills were divided up into. And the first skill set was just basic interviewing skills. And so those included making a positive introduction, right? So speaking of basic, like things like saying hello and smiling, greeting the person, introducing yourself, previewing that you'd be taking notes. This is something that's very specific to a virtual platform, obviously, because you can't see what I'm doing sort of underneath the screen. And so if I'm looking away, this was a way to be able to preview with families. Like if I'm not looking at you, it's because I'm taking some notes, right? And so I'm not disinterested. And then the other 2 were just nodding and back channel, right? And so nodding is obviously nodding, and back channel are those sort of minimal expressions that people say when they're listening, right? Like you just did, like, yeah, oh, okay. And so those were skills that we were actually teaching because we were noticing that, in baseline, those weren't happening. And so it was cool to get a sense from, some expert people, how often they were doing these things and then mapping those on to teaching some of the skills that clinicians would need to sort of be that active, engaged listener. So that's just the first skill set.
Yeah. Oh, I like that though, because with the whole virtual, because now telehealth is, in the speech therapy has kind of always had this side of teletherapy, but I like that idea even of like, I'm going to be taking notes. I think the other thing that we do is, I know as a parent, like my son had to get his tonsils out and we had it all set up and then they called me and the person that called me was like very cold and very short. And it was like, here, I'm taking my 2-year-old to be put under for tonsils.
Right.
And after that surgery, I called back and I really laid into them because organizationally, I'm like, for you, this is every day. This is your everyday. For me, this is my 2-year-old who's getting put to sleep. This is a huge, huge moment for me as a mom and for our family. But I think sometimes I know we're all in this field to help others, but we are not always thinking about like, what are the other person's feelings? Like you said, with that one skill, it's like, I'm thinking about my client's feelings. Because sometimes we have so much going on about a progress note, an upset parent, an administrator, a meeting coming up, lawyers, advocates, there's so many things that are going on, but sometimes these things can seem so basic, but and I do think too, like with the rise of phones, I feel like maybe that will rise and go, but I have seen people don't really engage in small talk. Like I was waiting for something the other day in the airport and it's like back in the day, probably 10 years ago, people would be like, oh, where'd you go? Or, we were all coming back from like this big golf tournament in Scottsdale. And it's like, There's no, as soon as people are like by themselves, it's like phones out, no one's talking. I feel like some of those normal common exchanges and like the affect, like the listening, like, oh yeah. Like I feel like some of those things, our skills are not as sharp because we're not doing as much talking to people. But that's just me
Yeah.
as a speach therapist kind of
No, I
analyzing.
totally agree. And I feel like it's me as well, but I feel like when I talk about that, I sound like a grumpy old person being like,
I
you know,
agree.
back in the day, we
Yes.
didn't do that and we talked to each other. So I'm with you on that. And I don't know if it's creating, deficits in those skill areas for
Yeah.
people who haven't had exposure to that, but it certainly is a possibility for sure. So, those basic skills.
Mhm.
Were in the first skill set. The second skill set was more related to showing interest in the family. So acknowledging the child's abilities or efforts, right? So the caregiver might say something about their child, and um, the clinician might be able to offer some interest by reflecting that, that's a good thing that their kid is doing. Like, oh, that, good for him. He's showing you this or that or the other thing.
Right.
So sort of focusing on some of the positive things, but just kind of showing that you're listening and that you're interested in what they're saying. Asking about the child's interests, asking about the caregiver's priorities, right? So if we're talking about an intake,
Mhm.
which was the scenario,
Mhm.
for these role plays, you're going to want to really understand what the family's priorities are in terms of skills to teach
Mhm.
and areas of need for their child, as opposed to relying on something like the ABLES or
Mhm.
the VB map or something, and sort of deciding on targets yourself,
Mm.
and
Mhm.
then reflecting and incorporating those caregiver priorities. Right. So what I hear you saying is that you'd like to work on X, Y, and Z. It sounds like that will be a really good thing for us to start, when little Johnny comes in, so you're
Yeah.
able to really show them that you're taking into consideration what their priorities are as
Mhm.
caregivers, which obviously relates directly back to social validity, right? And like
Right.
the foundations of our field. So as I mentioned before, it's really not all that different. It's just kind of operationally defining it and teaching it.
I do like that though, because something I've been giving it as a speech therapist is called the Rossetti, and it's for kids that are under 3, I believe. And so I'm licensed in Washington State. I'm sitting here in Ohio. They have a cool program up in Washington State. It's like the kids who qualify get 12 weeks of speech therapy and 12 weeks of ABA. So it's hard for these clinics to find a speech therapist in real life because it can ebb
Mm-hmm.
and flow. They might have 5 kids, they might have one. And so we support like 5 clinics up there. But what's neat is I've been using this Rossetti scale, which is nice because there's a parent questionnaire. So and I know like in an intake, we may not even ask like what brings you in today, because what might brings you in might be like my child got diagnosed with autism and
Right.
they recommended ABA, and things like that. But so I think those are important things to kind of talk about, because when we're giving the VB map or we're giving something like that, we may just not ask that type of question. You know what I mean? So I think that's important to discuss. Okay, so other skills. Is there a third set of skills? I think you remember.
Yes. Yep. The last set of skills, it sort of builds in complexity. And so the last set of skills is joining with the family. And so the 3 skills in that skill set were making an empathy statement, normalizing, and partnering. And that normalizing skill, I will say, was probably one of the trickiest. So the empathy statement is the empathy statement. It's pretty straightforward, right? Although we did think a lot about, making sure that it was done in a way that would feel authentic and
Mhm.
genuine, right? Because you can make an empathy statement and not sound sincere.
Mhm.
And then that normalizing skill was really intended to be reflective of some of the skills that the experts that I used as models were engaging in. And so that was doing things like saying, like, oh, yeah, that's really common. We see that a lot with kids with autism.
Oh,
Right. And
yeah.
so that's something that the experts were doing very, very well. It turned out to be a bit more challenging, particularly for, these master students who
Mhm.
were essentially pre-service clinicians who may
Mhm.
not have had a lot of experience with
Mhm.
kids with autism or kids in general.
Right.
So, I say that all the time that like, becoming a parent myself, I think was very, very helpful for me in understanding sort of developmental norms and, oh, that sounds, that's super common for 4-year-olds. Well, I wouldn't have known that before.
Right.
Right. And
Right.
that's something that I think is importantly an area of real need in the field.
That's so funny. I was on Behavioral Observations, Matt Sikoria's podcast last year, and he was like, "What do you think is lacking in the field?" And I was like, I'm glad you asked. I think a
Yeah,
course on speech and language development. So we have an ACE course that's like free in our membership. I'll link it in our show notes, and it's just, we need more, understanding of that. Obviously, there's only so much time, right, that we can put into the curriculum. But I do agree that, and as a parent, I feel more comfortable having those conversations, but it's just, that should be something that we learn more about. Yeah. So I'm glad you mentioned that. Yeah.
Yeah, absolutely. So that was just one thing that we noticed. And then the final skill in that skill set is partnering. So just sort of like making statements about, we're going to do this together, and,
Yeah.
Collaborative statements about working on things jointly, as opposed to like, I'm going to teach your kid this.
Yeah. Yeah. Oh, I love that. Okay. That's awesome. Well, that's amazing. I love just talking about the very specific skills, because I know some people are probably thinking to themselves like, oh, this is important. Or, like these are things that maybe, my staff is not currently doing, or that we could brush up on. And,
Right.
I know a lot of people do, their in-house training and things like that. So I think like this would be a nice journal article review. So kind of what are the next steps for people who are listening who want to directly work on training in this area of compassion, maybe for their teams or their staff? What do you think are some next steps?
Yeah, well, I mean, I feel like I sort of have to like put a caveat out there that these were the skills that I selected. I think that there are, certainly lots of other skills, and, these aren't necessarily going to even be the skills that are seen as, compassionate or desirable by all families, right? So there's always going to be some kind of, some sort of variation in there. Oh gosh, my light just came on.
That's okay. Well, yeah, thinking too, like culturally, even there might be, I don't know. I'm just thinking to myself, like I've worked with families of different cultures, and I know that's something we're always trying to be cognizant of. And maybe some of these skills, maybe you're working with a certain group of students, you're like, oh, well, that wouldn't be seen as, maybe that's too invasive, or maybe that's,
Totally.
like I would imagine that there might be some things to kind of analyze for your specific environment or your specific clients that you're working with as well.
Yes, that's a huge one. I think that the cultural piece is absolutely critical. With regard to next steps, I think that the other paper that I referenced with the compassionate collaboration tool, it might be, another resource that's helpful, because it was intended to be a checklist, like a tool for practitioners to use to, maybe gauge their staff's engagement in some of these skills. Use as maybe a self-evaluation or a self-reflection tool, something to maybe look over before you go into a meeting, to sort of remind yourself, oh, right, I should probably pay attention to doing these things. And so I think it, has a lot of uses in that way. And I think that group behavioral skills training is a real area of, I don't know if it would, be as effective as the individual behavioral skills training, but someone should certainly find out.
Yeah.
And I see a lot of areas of.
Oh, I like that idea. So the idea we did a behavioral skills training ACE course last summer. It's for ASHA too. Speech therapists don't always talk about BST, but as a BCBA, I do. But it's just good teaching. You know what I mean? Like, but I think what we often forget, especially when we're working with adult learners, especially if, like as me as the speech therapist, it's like I can work with the parapro or I can work with an RBT, but I may not be their administrator. So I feel like that feedback loop, that like last part of BST, we sometimes as adults feel funny about, but I always try to say like, when you're able to help somebody learn and grow in a skill, whatever that is, today we're talking about compassion. I feel like you're not only helping that person like right in this moment today, but you're helping them across all the clients that they're going to work with. Like, and these skills are so very important. So I love that. That is a cool idea to think about this. Because I know sometimes just, especially newer clinicians, or maybe, I've worked in places where some people get extra training because maybe they have a deficit in certain skills. So I feel like these might be kind of nice instead of just pulling out like things that maybe staff are having trouble with. You're like, oh, we're going to talk about the compassionate collaboration tool today. And these are the skills, so we'll make sure.
As opposed to here's what you're doing wrong.
Yes. On May 2nd, you did not ask Miss Smith.
Right. Exactly.
Yeah. So this kind of takes the heat off, right? Use the research. Okay. So we'll make sure to put that in the show notes, the links for both of those articles. Well, thank you so much. It was really great to have you on, and I really appreciate you spending your time and doing this research in the field.
Of course. Thank you again for inviting me.
Thanks for listening to Autism Outreach. If you enjoyed the show today, make sure to subscribe so you don't miss an episode full of actionable strategies you can use in your therapy room. Write a review too. That would mean so much to me. I always love hearing from you. Have a specific topic that you want included on a future show? Reach out over on Instagram, ABA Speech by Rose, or visit me at www.abaspeech.org.